soft miles back, still we go. The late boomers, the late boomers, heart still young, hands still sure. The late boomers still here, we carry on. This is the late boomers.
Hey guys, welcome to the very first episode of The Late Boomers. I am your host, Tom, and the better half of this duet is my wife, and she is not available right now. She's gone to babysit an hour and a half away to take care of the grandkids. So what's this all about? What's this channel about? Well, basically, it's about my generation. I am the tail end, and so is my wife, the tail end of the boomer generation. I am 63 years old. I just retired from my last job. I've been in the industry of that last job for off and on 35 years. And I do have a pension. It's not a fantastic pension, but it's a good pension. And I am due to receive my first Social Security paycheck. And at the end of this month, as a matter of fact, my last day from my last job was a week and a day ago, as a matter of fact. So what's this channel about? It's about my generation. So I thought to start it out, since I'm only 63, I don't qualify for Medicare. I don't have insurance. When I retired from my first job, it was daunting because I didn't retire with any kind of insurance at all. I ended up choosing Christian Health Ministries. They're Christian based. It's a share based medical help where when you go to the doctor, for example, you go to the doctor and they say, "Can we see your insurance card?" You say, "Well, I don't have insurance. I am planning on paying it on myself," something along those lines. And in doing so, can we negotiate a price that is affordable for me, since you don't have to go through insurance? You don't have to go to all that, I don't guess. They give you a script. I'm pretty sure they did. It's been a couple of years since I had them. And anyway, so they will work out more than likely a cheaper price because they don't have to go through insurance, and for a lot of other reasons as well. So I'll probably be going back to that. The last job, the one caveat that I really hated to let go of was my insurance that was provided by my company. I mean, it was like $50 a month. So that leads me into right now and why I'm bringing this up as a subject. There was a video I saw the other day of somebody saying he went to the emergency room because of his blood pressure. And he didn't say to what extent, he didn't say what his symptoms were, but he said he went to the emergency room and it was due to his blood pressure, high blood pressure. And he said, I didn't have any MRIs, I didn't have any scans, things like that. Didn't have all these ultra expensive things. He gets a correspondence from the hospital and it is a bill. And it's a bill for over $40,000 because his blood pressure was high. $40,000. None of this multi-million-dollar equipment. Just went to see probably a nurse practitioner because that's the way things go nowadays since our wonderful healthcare system changed over during certain Obama years. Oh, did I say that? I will probably have to edit that out. Anyway, I digress. And that's going to be I'm going to have the sign behind me that says that because that's going to be my catchphrase. I catch myself doing that a lot. Just searched health insurance costs. That's all I put in. I didn't say. So let me just read this for you guys, okay? In 2026, the average monthly health insurance cost for an adult on a silver tier marketplace plan. So that sounds like it's going with the Obamacare. It just has that language. It may not be, I don't know, but a silver tier marketplace plan, that sounds awful, healthcare.gov, is $687. I really miss that $50 copay for $50 that I paid. I'm going to miss that. $687 with significant variations based on age, location, and plan type. Costs generally rise with the age, ranging from $425 monthly for children to $1,448 for seniors. Now, guys, I'm here to tell you, if you're not of the age yet, about you're saying someday I'm going to collect my Social Security. Your Social Security is not going to feed you and pay for your health insurance. It's going to go, if Social Security is going to be your only income, you're not going to live for very long, unfortunately. And that's the plan. Whose plan? I would say the elite. I'm not going to get into that. I'm very much a conspiracy tinfoil wearing person. So that's for another day. So let's see. Let me get back to it. $1,448 for seniors. While plan flexibility also impacts pricing, with HMO plans averaging $674 and PPO plans averaging $790. Averaging. Age demographics. Young adults 18 to 25 pay approximately $553 a month. Okay. While premium increases substantially in the 50s and 60s due to the higher expected healthcare utilization. In other words, you're old and you're going to have more problems. I wasn't reliant on any kind of drugs up until just a few years ago. And it started out with my restless legs. And now it's blood pressure and the LDL, which wasn't that high, but the blood pressure is real. The last time I measured it today, as a matter of fact, it was 143/90 something, flashing orange. Geographic variation. State costs vary widely. Maryland offers the most affordable average at $440 monthly, whereas Vermont is the most expensive at $1,224 monthly. Plan tiers. Bronze plans have the lowest premiums averaging $494, but higher deductibles. This is the part. I mean, I was on Obamacare and I know what they're talking about. Yeah, you can get like $100 premium, and yet your copay for the end of the year is going to be $12,000. It was nuts. So anyway, plan tiers. Bronze plans have the lowest premiums, averaging $494, but higher deductibles. Yeah, that's where we were. While platinum plans have higher premiums, averaging $903, but lower out-of-pocket costs. It's confusing. It's really confusing. And the one thing I think for that Christian Health Ministries and Medicare, there's that as well. And that's actually where I first heard of these type of offerings. Is that it's a little more clear cut how it operates. You basically, as I said, you tell them you're going to pay for it. They work it out. The office works it out. Okay, this is how much we're going to bill you for. You turn that in to Medicare or with, in my case, Christian Health Ministries, and then they approve it, and then they pay it, and you have to keep up with it. From my understanding, and the reason I say my understanding, I never actually utilized it. I had it there pretty much for in case of, so I never used it. But Dave Ramsey, he reviewed it back in the day when I was looking up information on it, and he didn't give it a solid review, but he gave it a positive review. I'll put it that way. Employer-sponsored insurance. These plans are typically cheaper for the employee. Yes, they are. With an average contribution of $114 monthly for individual coverage and $525 for family coverage. So you see, where I was working was extremely, what's the word? Anyway, they valued their employees so much that they pretty much paid all of this. So anyway, subsidies. Individuals earning between 100% and 400% of the federal poverty level may qualify for premium tax credits that reduce monthly marketplace costs. So that confirms that confirms this is talking about healthcare.gov, flat out. So here's the part that really shakes me up, and it goes back already to what it says. This just lays it out. Age group, here we go. Children, average monthly cost $425 per month. Young adults, $553 a month. Adults 31 to 45, $687 per month. Seniors, $1,448 a month. So once you're over the age of 45, you become a senior in their eyes, I guess, is what that's saying. And your premium doubles to $1,448. And that's where it ends. So there you go. That's one thing I wanted, and that's where a discussion I would like to come in. This isn't to solve problems. This channel is not to provide answers. This is to bring up questions and what I'm doing. I do plan on going back with Christian Health Ministries. I do. They have what they call a gold tier and covers 100%. There's no 20%. They cover all that they say they're going to pay for. So, and it is Christian based. You can't just go off the street and say, hey, I want to be a part of this. You have to let them know what your affiliation is, what church sponsors you, or will confirm that you are a member. Guys, I appreciate you. I appreciate you visiting and giving our channel a shot, and hopefully we can come up with some content. If anything I've said resonates with you, I would appreciate some feedback, anything like a thumbs up or comment down below, or just if you think we might have a future here, subscribe and give us some ideas, give us some suggestions of things you'd like to hear or talk about. And that would be great for us. We really appreciate it. We're not out to do this to make money, because I know this is a cutthroat industry, YouTube. We're just doing this to stay busy at this point, obviously, because I'm retired. I think I said that once or twice. But again, it's also to build a small community, and we want you guys to be a part of it. So thanks again. I appreciate you guys, and take care. So I'll close right now. And again, I thank you for listening and watching, and I hope to see you on our next stream. Thanks, guys. Bye.